But we begin with COVID-19 as millions of Canadians across this country are gathering with friends and family this long weekend. And for some, this holiday weekend is being celebrated in person for the first time since the pandemic began. But COVID hotspots remain, and there is concern that long weekend gatherings will drive up cases and hospitalizations. So for more, let's go to Ottawa right now. Hilary Johnstone standing by, tracking the latest for us today. Hilary, nice to see you. What are we hearing from health officials on this weekend?
Hi there, Michael. Well, in some parts of this country, some of the indicators that those experts have been using to sort of see a lay of the land, how things are doing, like wastewater, for example, they say that they are seeing some evidence that things are plateauing in parts of Canada. The big question mark here is how those holiday-long weekend gatherings might impact some of those numbers. So if you take Ontario, for example, the COVID-19 Science Advisory Table says that based on their wastewater monitoring, they do think that we're possibly seeing a plateau, seeing things crest. Now, the number is huge. They're estimating that it could be about 100,000 daily COVID-19 infections, new cases every single day. That's the estimate. Seeing things plateau, but don't know how those gatherings might impact things. Here's what we've heard from one doctor.
I think what we have to remember is that if you look back over the course of the pandemic, every time there's been a holiday, every time there's been a long weekend, there's been a bump in cases afterwards. And so even if you do believe the wastewater data that there might be a plateauing of the increase in cases, that could change. If people are not careful over the course of this weekend, we could see a jump in cases over the next 2 weeks, and that's just going to make an already bad situation even worse.
So what doctors and experts are saying is that they understand people wanting to gather. Of course, there are not many restrictions left in many parts of this country, but they're still encouraging people to be careful. So if it's possible to have a gathering outside, of course, that is always better than in a crowded indoor area. Masking, if you are in a crowded indoor area, is going to be really key. And then the other thing we're hearing is that experts would like to see more people go and get their booster shot. That uptake, the numbers there for boosters are not exactly where officials would like them to be.
Okay, so a few things for people to bear in mind on this weekend, but let's also talk about hospitalizations, Hilary. Where do they stand right now?
Right. So when we take a look at hospitalizations, at this point, they're not as bad as they were during that fifth wave, so over the Christmas and New Year period. But if you take a look at this, on the far right-hand side of your screen, that big jump that you're seeing there, so that was that fifth wave, the one that we had over the holiday period. But if you take a look to the right of that, you can see it's starting to inch up again. So that's what we're hearing. This is the national picture. So this is data from the Public Health Agency as of last Monday, so April 11th. But what experts are saying is that this does show that things are starting to tick back up again. And even if we're not where we were during the fifth wave in terms of hospitalizations, when you see it there on the timeline of the whole pandemic, you can see that we are still at or above where we've been during previous waves. This time, though, after more than 2 years of this, we have, of course, healthcare experts, healthcare workers who are burnt out, who are tired. The pressure on the healthcare system, of course, is still great. And what some provinces are saying is that they do want to make sure that those numbers don't go up even further because they want to be able to care for all patients, including those who don't have COVID-19. So those numbers, of course, important to keep an eye on, especially as we come out of this holiday long weekend.
Hilary, thank you for that. The CBC's Hilary Johnstone.